Since the outbreak, COVID-19 has rippled through every facet of our society. It has caused multidimensional crisis impacting every aspect of our life. COVID-19 has enormously increased human suffering, millions of deaths globally, 500,000 deaths here in the United States. It has undermined the economy, turned the lives of billions of people around the globe upside down, has significantly affected the health, economic, environmental, and social domains. Governments around the world have imposed unprecedented, restrictive, and preventive measures to reduce the transmission of COVID-19. The socio-economic crisis has reshaped our everyday life. Here in the U.S., like everywhere around the world, COVID-19 pandemic has created both public health crisis and economic slowdowns. The pandemic has disrupted lives, pushed the hospital system to its capacity. While voluntary social distancing and lockdowns that took effect in March 2020 worked initially to isolate and drive down the infections, those actions precipitated a severe economic downturn. In the United States of America, according to the statistics, there are 28,200,000 cases confirmed. There are 500,833 deaths so far. To help our communities stay healthy during the pandemic, to prevent illness, to avoid being exposed to the virus, to prevent the spread of COVID-19 to others if you are sick, for those who have already been infected, to give some advice on how to fight COVID-19, how to boost the immunity system and reduce the harm of the illness. It is my great pleasure to have with me today a special guest from New York, the cardiologist, Dr. Anton Camaj. Dr. Camaj, welcome to Michigan. And welcome to ACTV.
Thank you, Edward. It's a big pleasure to be here, and I'm very humbled that you guys invited me to your show today. And it's great to be home.
Thank you very much.
Here with the Albanian Community TV.
It's a pleasure to have you with us today. Për teleshikuesit tanë, do të lexoj një statement në shqip për familjen, prejardhjen e doktor Antonit. Doktor Anton Camaj rrjedh nga një familje edukuar dhe adetare e hotit të malësisë madhe të mbi Shkodrës. Familje kjo e përsekutuar nga regjimet slave gjatë shekujve. Gjyshin e babës, Pjetër Zekun Camaj, shteti antishqiptar malazez e kishte pushkatuar në vitin 1945. Por megjithatë, kjo familje arriti të mbijetoj, të shkollohet si të parët e Antonit, ashtu edhe gjeneratat e tjera, gjeneratat e reja si Antoni. Shtjefni ishte i arsimuar dhe jepte mësim në shkollën fillore në Arës, Hot. Po ashtu Gjergji ishte pedagog. Zef Camaj ishte profesor i njohur i shkencave politike, veproi për 2 dekada edhe këtu në Mërgim dhe ishte një vizionar dhe politolog i pashoq ndër shqiptarët e Amerikës. Po ashtu Axha Nikol në Malsi është profesor dhe është kryetar i Lidhjes Demokratike Shqiptare të Malit të Zi. Axha tjetër, Pashko Roku Camaj, është doktor i shkencave në New York, kurse babai i Antonit, Frani, është një biznesmen këtu në Michigan, ndërsa vllai, motra e doktor Antonit janë duke përfunduar studimet me nota të shkëlqyera këtu në Detroit, pra është një familje me traditë shumë të pasur, patriotike dhe intelektuale. Dr. Camaj, you were born, raised, and educated here in Michigan. Would you please tell our viewers about your background, your family origin, your education, the medical school you graduated from, and the healthcare institution you are working currently?
First, I want to say thank you for all those kind words about my family. I know they're watching and they're going to be very proud to hear all those nice things. Going back to myself, I was born here in Michigan. I was raised here in Michigan. I went to St. Paul's Church and grew up going there every Sunday. Went to high school in Shelby Township at Eisenhower High School, and then went to college at the University of Michigan in Ann Arbor. And then I went to medical school there too. While I was in medical school there, I took a year off actually and got a master's in clinical research. So ended up going to school even longer. My parents weren't too happy about that, but it was something I wanted to do. And then I moved to New York for my residency to Mount Sinai Hospital, and I'm still there now doing my fellowship in cardiovascular disease. And so it's been quite the journey so far.
Very good. We're very proud of your background, especially the education. Doctor, let's get back to COVID-19 pandemic topic. As an ICU doctor, cardiologist, serving in the New York area, it's a highly populated urban area that was hit very hard by COVID-19. My question is, how could you describe the COVID-19 current situation in New York first, and then everywhere around the United States?
Yeah, so the situation currently is a lot different than it was in March and April. Obviously, March, April was, headline news what was happening in New York with COVID. It was a nightmare to be there. People were dying at, high rates every single day. And the city was completely shut down. So it was a very dark time, but we were able to get through it. The summertime was pretty nice. Everything was outdoors and the weather was great. So everybody was, more or less happy around. Since the fall came, we saw a rise in the cases and hospitalizations, of course, but it wasn't quite as drastic or dramatic as it was back in the spring. That being said, people are still getting very sick. You're obviously still seeing a lot of people dying and not doing so well. But I will say our treatments have gotten a lot better, and because it's not as, it's not as spread as it was back in the spring. There's not as much community spread. The resources are a little bit more attainable for doctors and nurses and whoever else is working in the hospital. So we've been a little bit more organized this time around. And so our action plan has been a lot better. And so we're seeing some better outcomes, I think, now. The rest of the country, I haven't really spent much time around the other parts of the country because of travel restrictions and things of that nature. But I do know that this second wave probably hit other places in the country a little harder than the second wave hit us in New York. And so I know if you go out west, particularly out west, there have been some states that haven't been doing so well. But just kind of looking at the national landscape, it looks like we're turning a corner with the second wave right now too. And I'm really excited about this vaccine rollout and hoping that that can speed up a little bit too.
How do you describe your routine, like the daily routine, as you go to the ICU as a doctor every day, feeling the pressure of the COVID patients, the overall pressure that our healthcare institutions are feeling? Has it changed? Like, is it harder? How do you describe your daily routine?
So I think that's a good question. I think day to day, when I look back, there are certain aspects of my day that have changed, probably permanently, or at least for the foreseeable future. I wouldn't say things have gotten harder. It's just a little different. And so every time you see a new patient, we're making sure we're gowning up. We have our N95 masks. We have a second mask on top. We have protective eyewear, gloves, and things like that. Once we know that the patient is COVID negative, it's obviously a little different story. We can kind of take down a little bit of the PPE and just go in with a regular mask. We don't need the N95 in that scenario. Obviously, you're going patient to patient. You worry about your team, other doctors on your team, nurses, and other staff. So, everyone's got a higher alert to, kind of how they're dealing with patients these days. So, if we're accepting a patient as a transfer to our ICU from another hospital, we always want to ask what their COVID status is. Have they been tested? Even when they come, even if we know they tested negative at the other hospital, we isolate them. We put them in a negative pressure room usually, and we make sure that they test negative at our hospital too, before we treat them like somebody who might not have COVID. That's really been it. Other parts of the hospital, they've been able to organize things, based on COVID floors and COVID units, things like that. So there have been dedicated places now in the hospital where we've been sending patients with COVID to kind of keep them away from the rest of, the people who obviously work on the front lines and in the hospital, and from other patients who are coming to the hospital for other problems. Last thing you want is them to come to the hospital and get an infection, especially COVID. So.
Let's talk a little bit about those people who are right now suffering the COVID symptoms. Those who are sick, have been infected by COVID-19. What would be your advice, the do's and don'ts for those people who are right now experiencing the illness?
Yeah, so that's also another good question. I think if you're at home and you're feeling sick with COVID, you need to, you know yourself the best, and you need to understand how you're feeling. The biggest thing really is, should I go to the hospital, or should I go to my doctor, or should I just stay home? I think that's kind of where people, those are kind of the three buckets people are in. And really it all comes down to how they're breathing is the big thing. If they're breathing okay, they should just stay home and isolate for at least 10 to 14 days and try to stay away from other people, stay home and take care of themselves. If they have a headache or something, maybe take Tylenol, making sure they're staying hydrated, they're eating and drinking, good foods and things like that. And definitely making sure they get good rest. For those people who their breathing is a little compromised, they're starting to notice they're having a hard time breathing. And this is different than coughing. Coughing is one thing, but if they're really having trouble breathing, those are people who should at least see their doctor, if not go to the emergency room.
When is exactly the point that someone who has COVID-19 right now has to go to the hospital or call the emergency? Like, staying home is the best advice initially if the symptoms are not as serious, if the breathing is hard but not deoxygenated to critical levels, right? And can we talk about that? People, I think, measure the oxygen level themselves somehow at home. What are those ranges, the critical level of oxygen that people should be aware of?
Yeah. So it's nice that some people have these, what we call pulse oximeters at home. But I think most people probably don't have them. They're not very expensive or anything like that, and I wouldn't tell people to go out and buy them. I don't think they're that necessary. I think the biggest thing is, again, how the person is breathing. If they feel like they're short of breath, they should at least call their doctor at the very least. If they have a thing to check their oxygen levels at home, the number we usually look at is about 94%. If you're 94% and above, you can usually just stay home and keep an eye on it. Once you start dipping below 94%, so let's say 91, 92, 93, I would say call your doctor. If not, schedule an appointment with your doctor. Anything lower really than 91%, you probably need to at least be seen in the emergency room. But 94% and you're not feeling well, I would at the very least call your doctor and try to get an appointment with them, or go to the emergency room at that point. But again, I wouldn't just look at the number. I would look at how the patient's also feeling. It has to be kind of a combination of both.
And now let's get to our community and try to give some advice, some tips, how to stay safe and healthy. This, I think, is the last stage of the pandemic period. Has been long enough, has been more than a year. Now people are tired of feeling the pressure, being isolated, socially, separated from family and friends. How do we continue now at the stage that we are in to stay safe and healthy?
So, I hope you're right. I hope this is the final stage. I think we're all really tired of COVID, whether working in the hospital or not. Everybody, I think, has really gotten tired of hearing about it and having to deal with it. And I think people want to go and live their lives again and live a normal life. And I think we all want that. I certainly want to be able to do that as well. And the biggest thing, I think, and I told my parents this too the other day, it looks like vaccines will probably be ready for most people in the next 2 to 3 months. That's just kind of numbers we're hearing. It's not a guarantee, but I'm optimistic in what I'm hearing about that. And I think we're almost there. We're almost kind of at the finish line, if you will. I think once we can get everybody vaccinated, I think it really is going to open the doors for moving forward with our lives and leaving this in the past. And so I would say, these are the final moments, like the final countdown. Just kind of toughen it out for, a few more weeks, few more months. I know a lot of the older people now are candidates for the vaccine. And eventually that's going to trickle down to younger people as well. So we're almost there. And we made it this far. It would be a shame to just kind of let everything go. But I think we're getting there soon.
Dr. Antoni, you contracted COVID, right, yourself?
Yeah.
Can you tell us a little bit more, like, what was the secret of fighting when you fight for yourself?
Yeah, you know, I'm fortunate that I'm a relatively young person, and I try to exercise as much as I can, so I wasn't so sick when I had it. But I had it back in March, so it was very early on. And
Yeah.
I had a really bad cough that wouldn't go away for 2 weeks, and I couldn't smell or taste anything for a couple of weeks either.
So you lost the taste.
Lost my
as
sense
well.
of taste and smell. Okay. And even to this day, certain foods now, they don't taste the same as they used to. So like, for example, if I want to have a Coca-Cola, it doesn't taste like it used to, and it's unfortunate because I like to have a nice glass of Coke once in a while. So can't do that anymore because it doesn't taste good. When I had it, you know, I didn't feel very sick. I just had this cough, and I couldn't taste or smell things. And it was at a time where we didn't have a lot of testing available.
Yeah.
And I wasn't having fevers, and I felt fine. And so, you know, I didn't technically test positive for it. A few weeks later, I got tested, and I had antibodies. So there was documentation that I was at least now immune to it, which was nice. But I had it, and I was very fortunate because, you know, working in the hospital, we saw people, you know, in their 30s, 40s, 50s, also dying. It wasn't just the old people who are really sick already. Of course, those people are at highest risk, but at that time, we were seeing people in their 30s and 40s, 50s, and it was really sad because you would get, you know, like a 42-year-old man come in. He said, you know, yesterday I felt fine, today I couldn't breathe. The next day he would pass away. And you'd have to call his, you know, like his wife or something at 2 in the morning and say, hey, I'm sorry, your husband, who was completely healthy 2 days ago, just passed away. And so those are moments that, you know, the news doesn't really capture. And you don't really see that in the news. You see a lot of the numbers. So that's how it was. There was a lot of, you know, different emotions battling COVID, both as someone who was infected with it and then also having to deal with patients who had it. So I'm glad that, you know, I feel like the worst of the worst is behind us.
I'm glad too that you had some mild symptoms. It was easy on you. This COVID-19 and the way the immune system responds is very different to different people. Now, there is a misperception among Albanians, especially, you know, with our tradition of drinking alcohol, raki, for example.
Yeah.
COVID-19 is an inflammatory disease, right?
Sure, yeah.
And alcohol is a substance that increases the inflammation, right? People who drink alcohol think that we're drinking raki because the raki works as a disinfectant for your body. In fact, it works the other way, right?
So I will say, you know, as much as Albanians like to have their raki, I still think most Albanians are smart enough to know that it's probably not good for you. Sure, it has some properties where maybe it's cleansing or, you know, can sanitize things, but there's definitely no data to support drinking raki to fight off COVID. I can tell you that much. And the next thing is that you're right, alcohol does increase your levels of inflammation, and then it also decreases your immune system's capabilities. So it really disarms your immune system. So now you can't fight off the virus if you get it, and you're in a pro-inflammatory state. So it's actually a perfect storm for people who are having a hard time drinking or, you know, shedding the alcohol. It's a perfect storm for them to get really sick. So I would advise people to not use raki as a
slow down on the raki.
Slow down, if not completely stop, and, you know, have it in moderation once in a while.
Okay.
With or without COVID, it's probably not a good idea to drink it too.
How about people who smoke?
Yeah.
Smokers are at a high risk as well.
Yes, smokers are definitely at a higher risk, and this is something that's been studied and documented. Smokers, you know, COVID is its worst because it affects the lower airways. And unfortunately, when someone smokes tobacco or any other substance for that matter, that smoke goes into their lungs and increases inflammation in the lung. And COVID does the same thing. So you're really just setting yourself up for a rough course. Yeah, so I would say, you know, for people who smoke, try to quit if you can. And obviously, don't pick up that habit if you don't smoke.
Let's talk now about vaccination. The vaccines are now approved and available. There are 3 or 4, Pfizer, Moderna, AstraZeneca, and Johnson & Johnson, which is in the process of getting approved. There is some skepticism, especially in our community, Albanian community. and skepticism and hesitation. What would be the advice in this case? Should they go ahead and take it? There are no risks associated with the vaccine for people who are on the line approved to take the vaccine.
My advice would be very simple. I think everybody who is able to get the vaccine should get the vaccine as soon as they can. I got the vaccine because I work in a hospital. No one forced it upon me. In fact, I had COVID in the spring, so I already felt like I had some level of protection. I still got the vaccine as soon as I could get it. There's a bunch of vaccines around. I think they all work very well. In terms of side effects, people report soreness in the shoulder, which is typical even after like the flu shot. I know my shoulder was sore after both vaccines. I had the Pfizer vaccine. I don't own any Pfizer stock or anything, it was just the one that was offered. But 2 shots, my shoulder was sore, but I felt fine. Everybody hears about these reports of one person, had a fever, one person felt pretty sick for a day or two. I think mild symptoms like that, somewhat expected, but it's far better to have something like that than to go through, I think, what we went through in the spring and summer, and then also this last fall. So I would say for those of you who can get it, I would get it as soon as you can. And for those of you who will surely be candidates for it soon, I would not hesitate to get it. I would go ahead and get it and move forward.
We talked somehow about the alcohol and smoking, cigarettes as well, that exposes people to high risk during the COVID. What are some of the good foods when it comes to diet? People take a lot of immune system boosting vitamins and drink certain fluids or juices. Can you please give some advice? So
I would say in terms of diet, there's nothing wrong with the Albanian diet in terms of, you shouldn't eat this or eat that for COVID protection. I would say the biggest thing is to try to eat a healthy diet. Eat, good foods, eat fruits and vegetables, and try to eat, nuts and things like that. Seafood, less red meat. Obviously, we like to eat red meat. We like our lamb, we like our steaks and things like that. There's nothing wrong with eating those either. Yeah. But obviously, you don't want to make that a central part of your diet every day. Sweets to a minimum if you can. I wouldn't really change my diet too much because of COVID. But I would recommend people to just live a healthier lifestyle if they can. I would use this whole experience we've had to try to be healthy moving forward, because it's really the people who aren't healthy that were hit the most and affected the most by COVID. The people who were either younger or just healthier, they tended to do okay even when they had it. And so the biggest thing really boils down to is how do we take care of ourselves? And it's all about having a balanced diet and having a good amount of exercise, at least 30 minutes a day, 5 days a week.
How about the vitamins?
So I will make a comment about this whole, the vitamin industry is a big industry in this country and around the world. There's not a lot of evidence to support using it. I think to a lot of people who see these things, it makes sense that, I should have these vitamins. But you usually get all these vitamins in a diet and like a nice, enjoying good foods and healthy foods. And you don't need to be spending your time or money or energy thinking about, what should I buy from the drugstore to help boost my immune system. I think it does give people peace of mind. And so if you really feel like it's going to help you feel better, I think it's okay. But there's not a lot of data to support, taking zinc or any of these other things that's really going to help protect you from getting COVID or being really sick from COVID.
So relax, sleep well, eat well, healthy, of course. Yeah. And when it comes to exercise, there are people that think they should exercise more now.
I would say people should exercise. Obviously, if you're old and sick and things like that, maybe take it easy. But I think for most people, 30 minutes to an hour every day of something continuous, running, riding the bike, swimming, these are all really good things to do every day. I would recommend at least 5 days a week, minimum 30 minutes a day. It's hard to do, I think, for a lot of people. It's a new habit you have to form, and a lot of people get comfortable not doing these things. But I think once someone starts doing it after a few weeks to months, it really becomes kind of part of your day-to-day routine. And then I think people have a hard time giving it up. So you know, once you can really build that habit, I think it's really good for you. I think exercise actually boosts your immune system long term. And I think, you know, for overall health, for COVID protection, having a strong immune system, being physically fit, being in shape, being healthy, these are all good things. And I think that's the best we can really do to protect ourselves just kind of overall. So.
Back to the vaccines, there are no side effects. There are probably 1 day or two after that they feel a little bit tired.
Yeah.
But that is, you know, the time interval during which the body is trying to, you know, produce the antibodies or prepare your body to fight for any COVID viruses that you will be exposed to. Nothing else. Like there have been a lot of things out there, especially in the social media, saying that the vaccines will change your natural DNA structure and create a lot of other health issues.
Yeah. So I think the first thing you were asking was about the symptoms. So I know some people will feel shoulder soreness. That usually lasts about a day. Other people will feel, you know, they'll feel kind of sick. They'll have body aches, headaches. Some people have even reported fevers. And that's just a sign of your immune system really, you know, like you said, being activated. Those symptoms usually resolve within, you know, 24 to 48 hours for people who do feel, you know, kind of under the weather after they get the vaccine. Yeah. In terms of altering DNA, it doesn't do that. I know there's some misconceptions. It's a new technology that they're using called mRNA virus. That's really just telling one part of the cell to make a protein that the cell expresses on the outside that the body recognizes as, oh, this looks like a COVID cell, and now you make an antibody to it. But it does not get involved in the DNA, and I think it's actually a very fascinating and exciting technology, and I'm really grateful for it, and I think it's going to have application for other diseases down the road. So I think we're very fortunate to have had vaccines that were, you know, I think we developed them from February to they were available in a very short November or something like that. You know, that's amazing, and I think people should be proud of what our scientists and researchers have been able to accomplish. I think it's a really huge thing.
Talking to our viewers, the patriotic Albanian community here in Michigan, sometimes we see that in Albanian environments, families, small gatherings, people think that they cannot keep the mask on because you don't show respect to other people. Should we always keep the mask on? It protects not only the person wearing it, but other persons in the room as well. So
the mask thing has become, unfortunately, I feel like it's a big political issue. And I think within the Albanian community and almost pretty much any other cultural community, you name it, people don't like wearing masks and they're uncomfortable. I don't like wearing masks. You know, I have to wear them all day in the hospital and they get kind of annoying. So I understand that. I think if you're in large crowds, it's appropriate. It's not 100% safe. It's not the best solution we have. But if I'm wearing a mask and you're wearing a mask and we're a few feet apart, you know, the chance of us to spread something is a lot lower than had we not had the masks on. And so they're not foolproof, definitely. And there's definitely like N95 masks that are going to be much more superior. But those are much more uncomfortable. So I think asking people to wear those every day would be even more problematic. But like I said earlier in the show, I think it sounds like we're almost there. I think the worst is behind us. We've done a lot of work to get to this point over the last year. And you know, I think if people can just view this as showing another way of actually showing respect to others, trying to protect myself, I'm trying to protect you and your family, and I'm trying to protect my family. I think if you think about it that way, it makes wearing the mask a little bit more, makes it a little easier to do.
Doctor, we covered, I think, some important aspects of COVID-19 pandemic. Now let's get back to the Albanian community, Albanian issues, the diaspora here. How well are you connected to the Albanian community in New York? There is a significant, very large and strong presence in New York. And here in Michigan, like Michigan is your home, right?
This is my home, yeah.
You were born in Michigan and educated here. You had your high school, university degree, the medical school. How do you connect to the Albanian community?
So I have a lot of family and friends in Michigan. This will always be my home. I have family and friends in New York that are Albanian. I have family and friends also in, in Malsi over there. I try my best to stay connected. I think we can always do more. So that's why I was excited to come on this show. So I was really happy when you guys invited me. Part of it is to educate the community. I think that's important.
Yeah.
One thing I've been doing is through various social media outlets, I've been connected with other young Albanians who want to pursue careers in medicine. I've mentored a number of them, and I've been pleased to see them getting into medical school, moving on to residency, things like that. There have been a number of Albanian doctors in New York who have kind of welcomed me to that Albanian American, doctor community, medical community, if you want to call it, in New York City. So I've had the chance to meet a few of them and kind of get a sense of what they have going on. And it's every day I feel like I meet somebody or encounter somebody, whether it's in person or through through another connection or through social media. You just never know who you're going to meet, and I'm always really excited whenever there's some Albanian that comes by. And that's been my big thing, is really trying to outreach, trying to mentor people who want to pursue medicine. And if I can't help them, I've been fortunate enough to have a lot of successful friends and who are well educated or doing something very wonderful. And I've tried to connect people with people I think that they would be a good fit with in terms of just professional development. So that's what I've been doing. I do feel like there's more I could do, and I look forward to doing that.
Like in Italy, young doctors, well educated like you, some of the best ones in Europe, all Albanian doctors got together. They established groups on Facebook or social media where they provided advice for the government in Albania and in Kosovo, and of course in Malsia and Macedonia. They were very active, being in touch with the Albanian doctors. Albania, for example, is having a hard time right now. The numbers are rising, death numbers are increasing every day. Have you thought of something like this? Because United States of America is, I think, the epicenter of the scientific developments when it comes to strategies, medicine, and vaccines.
So in terms of reaching out to Albania, I have not been involved in those activities, unfortunately. And I think part of me would really like to get involved, but I think another part of me recognizes the challenges of doing something like that. There's going to be a lot of political obstacles.
Yeah.
And so you don't want to. I don't want to be viewed as this outsider trying to come in to teach people how to, do things. But if there was a way I could help out or anything like that, I would love to do that. So.
Advisory groups not giving strong political opinions on solutions and strategies that they had to follow to fight COVID, or just giving simple advice to people. There is a lot of chaos in Albania and Kosovo. Kosovo is a little bit better. We have to mention that. Malsia has been okay so far. Macedonia and the government there is very disciplined, so we have to give them some credit. Albania, I think, is now having a very hard time. Obviously, Doctor, you don't want to get into politics, even the politics related to our Albanian regions in Balkans. But do you follow politics at all?
Here in the U.S., I follow pretty carefully. I was actually a political science major in college.
Oh, you had the political science before you got to the medical school?
Before I went to medical school. So it's always been something I've been interested in. Follow, at a distance Europe, because I feel like we have enough problems here.
Yeah.
But yeah, I do keep a close eye on things. And, I will say when things were getting really ugly back in April, I remember thinking, as bad as it is, I'm really happy I'm not a politician right now having to make big decisions about these things. Because I think no matter what political party someone belongs to, if they were in a position where they had to make decisions about COVID, it was a lose-lose. It was a really tough time to be in politics. So I felt sorry for all of them. Yeah.
Dr. Anton, thank you very much. It was a great pleasure talking to you, getting some advice, discussing the struggle we are in. We have been for a year now fighting against COVID. Thank you very much. We wish you the best of luck, great success with what you're doing. We're very proud of you.
Thank you so much, and thanks for having me, and hello to my mom and dad.
So, teleshikues të nderuar, e përfundojmë këtë bisedë me doktor Anton Camaj, një nga profesionistët, doktorët, brezi i ri të shkolluarve, cilët na bëjnë krenar. I urojmë atij sukses, ju falenderojmë juve për vëmendjen, do të takohemi përsëri në emisionet e ardhshme.